A renowned bariatric and general surgeon from Las Vegas talks about his education and experience. He specializes in advanced bariatric laparoscopic surgeries, complicated hernias, and gallbladders. This is a 6-part video series. In this video, he explains the difference between sleeve gastrectomy and lap band surgery.
I'm a bariatric and general surgeon. I completed a fellowship at USC in advanced laparoscopic surgery. We addressed a lot of complicated general surgery issues such as complicated hernias and also complicated gallbladder disease. Although the majority of my practice is bariatrics, I still do these procedures. Well, the gastric sleeve is a newer weight loss operation. It's been around for about 8 years now, although it's been around as part of our other operations that we do since 1988, so it's been around for a while. And in the gastric sleeve, what we're doing is we're shrinking the stomach down to a sleeve or a long, narrow tube. And we do that by freeing up the majority of the stomach and taking a stapler and going up and cutting off about 85% of the stomach. We use something called a bougie or a sizer to make the tube the appropriate size. We don't want too narrow, we don't want too big, we want it just right. And we use that bougie as a sizer, and we come alongside that and staple up on the stomach and taper it down to a long, narrow sleeve that empties down at the bottom. And it's a nice operation. I really like the gastric sleeve because it seems to give us all the benefits of a band, because now you have lots of restriction like a lap band would do or a realized band. You have lots of narrow restriction, but it also gives us benefits of the bypass. The hormonal changes that we see in the bypass that are so powerful, we see in the sleeve. So for example, hunger, when you're hungry, when you diet and you eventually fail, that hunger hormone is called ghrelin, and that's produced in the stomach, and that's taken out with the sleeve. So with the sleeve, it's a tapering of the stomach, making it a lot smaller and narrower, and we're getting two things out of it. We're getting good restriction, and we're getting good hormonal changes as well. Okay, well, choosing a surgery is very difficult. We don't have in our profession a guidebook. I wish I did. I wish I could look it up and say, well, you drive a Honda and you vote Democratic, so you get a band. We don't have it. We have to go on patient comfort and what they're comfortable with. So what I try to do with patients is simply tell them about the operations, tell them the pros and the cons, because they all have them, for the band and for the sleeve, and see what clicks with somebody, what's comfortable. The band is a nice operation. The reasons I choose the band are because it's the safest surgery I can do for my patients, and as a surgeon, that's always my first priority. It's the safest surgery I can do. It's reversible and it's adjustable. So these are all options that are very strong and safe for my patients and allow me a good night's rest as well. The sleeve is a little more aggressive of a surgery, but the benefits are definitely there. In the sleeve, we're actually cutting things away for the first time, but we're getting not only restriction but also some hormonal changes as well. So the weight loss is a little bit stronger with the sleeve. The weight loss may even be as good as the bypass with the sleeve. So it's hard to choose between them, and again, it's just up for the patients, what's comfortable, what clicks. Some people, for example, want to have the safest surgery, which is understandable. Well, that's going to be a band. Another person feels like they have to have the strongest surgery available, but still want to be safe. That's going to be a sleeve. Another person might not want a foreign body inside of them. The lap band is a foreign body. It's meant to stay there for the life of the patient. So that, again, is the sleeve. So there's various reasons for choosing. It's important the patients are comfortable, and it's important that they know that whatever reasons they have are good reasons. There are no bad reasons to choose these operations after you talked with your surgeon.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote.